Um, Sorry. Welcome, everyone. Thank you for coming to listen to me and to my little presentation on acupressure and stretching techniques for self-care. I am a registered acupuncturist and TCM practitioner, and I work here in Canada. But often, like I have family, etc., asking me for different tips on what they can do. Like my family lives far from me, and I kind of tell them do this point, do that point, and so in my experience, like sometimes. Acupressure little techniques can really help in calming the situation when you're feeling super stressed or having little aches and pains, and just a little tool set for you. So this is what I have here. I've tried to address points that are more like upper body issues because of the whole Zoom call, and try to find points on the hands that we can use or in our scalp to kind of help with alleviating things like stress, anxiety, headaches, neck pain, shoulder pain, TMJ. I'm very happy making it interactive. So if you have any specific questions, please do ask them, because it's always more fun when somebody asks a question and you can kind of suggest something in response, right? And you can try it with me. So after the slideshow, maybe we can do a little bit for the face just to kind of help relax the face as well. So that's my plan for now. But if you have any questions about stuff that is not here, you can always ask me. And you can even email me later on. My details are in the last slide. And if you're interested, we can always have a one-on-one conversation afterwards. Sorry, just going to the slide here. Okay, so what is acupressure? So acupressure is, I guess, just applying pressure to specific points on your body, and it's like we're stimulating nerve endings at that point to kind of help send a message to the brain to promote healing in a specific area. So there are many schools of acupuncture and acupressure, because I don't know whether any of you have ever had reflexology. So they always say that you can treat different parts of the hand or different parts of the foot or the ear to kind of stimulate healing in different parts of the body. And so acupressure is something similar, just kind of pressing points on the hand, etc. But you could do it to not just the hand, feet, and ear, but you could do it to, say, your forearm or different areas. Needles are always more effective, I find, for somebody who's not needle phobic. But if somebody is needle phobic, this is like a kind of a nice solution to help you. So how do you do acupressure? So there are different techniques. So I'm going to try and demonstrate on my hand, and you're welcome to try out the different ways that I'm doing it. So one is, so I'm just kind of bringing it up near my hand near the camera here. So one is like you could just kind of apply pressure with your thumb, like so, and then just press and release, like press and release. So that is one way that you could do it. Or you can just kind of press your thumb like a point here, and then move your thumb back and forth like so. And it's like a little bit more aggressive form of acupressure. So you're not releasing at all. You're just kind of moving your thumb back and forth to really try and stimulate whatever results you're looking for. The other is sometimes we will do acupressure in circular motions. So, for example, if I'm going with my forehead here, I could just kind of do like a circular movement like this. Or you could even go back and forth, so back and forth like that. Okay. So a few different techniques. You can see what works best for you. It's kind of hard to demonstrate everything on a camera. But so I might adapt my technique based on what is best visible on the camera for you. But you can even apply acupressure using a pencil. So the soft top of a pencil, you know, where the eraser is, you could just kind of press using that as well. Then in Chinese herbal medicine or acupuncture, we have something called ear seeds. And you can purchase this, and basically it has like little seeds on a sticker, like a surgical tape. And these are called Vaccaria seeds, Vaccaria seeds. And you can kind of, you can kind of take the seed and apply it to an acupressure point and press on that. So it's like, so you could try and use like a lentil bean or something like that as well. So it's a very, very tiny seed, and you apply it on a point like so. I don't know whether you can see it. And you just kind of press. And this is like more focused acupressure on a specific point when you're looking for a result.
I wonder if when you're doing the presentation, like for actually showing on, because right now we see the slides more. Did
Oh,
you
you don't
want
see
me to
my
stop
hand?
the share?
You don't see my hand when I'm
I
demonstrating?
see it okay. I don't know if everyone else can see okay. If you guys can just put a comment in the chat to make sure that you're seeing things okay, let me know. They can see, so just go ahead, then we're good.
All right. Okay. Thank you. Okay, so stress, who doesn't have any? So this is a series of 2 points between the thumb and the index finger. So, but more along the index finger, like right by the side of the bone, between the bone and the tendon that you will feel there. So it's almost like you have to find points right at the base of the phalangeal and the metacarpal junction here. Like, so basically between the bone of the finger and the wrist, you feel like a big bump here. And so right nearer, like the wrist, you know, the proximal side, you're going to press there. And you just kind of, as I said, you can move back and forth like so. And this point, like, you know, sometimes when you're feeling kind of really high stress, like you're feeling anxiety rise to your face, or you know, a lot of tension in your jaw, or just kind of feeling kind of grumpy, and sometimes you can feel frustrated or grumpy, you can kind of press on this, and you might find that right as you do it. So basically there's 2 points. I'm going to just start drawing on my body here with a marker or a pen, and I'll show it to you. Sorry about that. So 2 points right at the along the bone on the side of the index finger. So here and here. And now don't overthink it, that is it over here? Is it over here? If it feels like a sensitive in any area around there, you can kind of press there. So even if it's not the exact point, but you could just kind of go along the bone from here and just kind of massage all the way down as well. I'm just showing you the 2 points that I would needle as an acupuncturist, but as when you're doing acupressure, you have more freedom and you can kind of go all along, because as an acupuncturist, I'm not going to put like so many needles in you, but when you're doing acupressure, you can just kind of move along. And you will automatically find that when you're closer to the junction here or closer to the junction here, that the points are more sensitive. And so those points are really good for relieving stress and tension from the face and the forehead, or even like anxiety when you feel it in your chest. Funnily enough, these points are also very good for digestion, because this is actually the large intestine channel. So if you have any issues with, you know, regularity or etc. as well, you can always massage along there, and that should help you as well. Okay. Any questions so far? I guess not.
quick question, but I'm not sure whether I should put it in the chat. Is it for both hands or just one side? Like it's the same on either side?
Yes, it is. I'm just right-handed, so that's why I'm doing it more on my left hand with my right hand, but you can do it both ways. And in fact, sometimes when you only massage on one side, after a while you might find, like say you've been massaging yourself regularly on one hand, and then you go to stimulate it and you don't feel the same response, switch to the other hand then. And because it's almost like we say, that the body after a while, like you get used to it and you don't respond the same way, so then you choose a different side to start stimulating on that side. Okay. All right, so I don't know, as I'm getting older, I find that when I get stressed, it's hard for me to think clearly. Sometimes, like, I know I have to get things done, but I'm like, I just can't make myself sit down to do the job. So between your eyebrows, right in the middle here, is an acupressure point called yin tongue. The name is not relevant, but basically it's kind of like the third eye. Third eye is supposed to be a little bit higher, but this is like more like right in between the eyebrows. So right here. And what I usually do is I will either do acupressure going up, but again, I like to kind of stimulate using back and forth movements here to just kind of calm down. And I close my eyes and do some big deep breathing techniques. So we can discuss what I mean by deep breathing as well in a few minutes. But basically massaging along here can just kind of help improve your focus. This is where when I was in acupuncture school, what I did often was use these seeds that I was showing you, and I would just put a seed here and press on it, and it was amazing because it would help me focus on my studies and do better in my exams by just stimulating this point. So it's very good when you're trying to go to bed as well and your mind is racing like crazy and you just cannot decompress. Press on this point and just kind of stimulate it and do some deep breathing, and you might find that your mind calms down and you're not thinking unnecessarily, but instead you might fall asleep. So it works very well in improving your focus but also helping you relax. So it works both ways, and highly recommended. In fact, a lot of us carry tension in our faces. Like, you often see people get like, inverted smiles and stuff because we're so tense. So it's important to kind of help relax the face, because when you relax the face, your body will follow as well. All right, any questions?
I just was wondering, those seeds, when you showed it, it was really small. Can you tell me what the name of it is? And I'll just put it in the chat again.
Yeah, it's a Vaccaria seed. It's Vaccaria seeds. And this box has like about 100 seeds and it's less than $10 in cost. You can order it online. The company that I usually buy my stuff from is Lire, Lierre. It's based in Montreal and pretty economical and a good way to kind of stimulate your own acupuncture points to feel calmer. Any other questions?
I'll put the link for that site in the chat.
Oh, that's nice. Good for them. Good for Lire. All right, I'm going to move on to the next slide. All right, so this is a point. It's called pericardium 6. And it's basically the pericardium channel. So pericardium is actually the protective covering around your heart. So, and this point, when you stimulate it, is very good for anything in your torso. So it can work well for anxiety. It can work well for nausea. It can work well for vomiting, for motion sickness. In fact, if you have ever experienced motion sickness and you have bought those C bands, the bands that people wear on their wrists, it actually tells you to stimulate this point, this acupressure point on your body. And the way to determine where this point is actually located is, so if your hand is up like this, and it's like, take the other hand and go to the middle of the wrist there, and that's a measurement. So right around here is your pericardium 6 point, okay? And so the wrist is pretty, I mean, the forearm is pretty big. So the exact location is actually between the two tendons here, but it doesn't matter. Again, you can just seek around for sensitive points. And if you find it's more sensitive on the inner side, do that, because as we rotate our arms, the points move as well. So just look for the point that feels most sensitive in this area when you're feeling anxious and press on it. And it's really good, when somebody's experiencing chest tightness or like panicky, like I have had clients when they have panic attacks and they really are feeling like, the chest is so heavy and tight. You can press on this point and help relax them. So if any of you experience from anxiety or panic, or if you have children who get panicky, it works really well for them. Works really well for pregnant ladies when they're experiencing nausea as part of morning sickness. And I have actually a beautiful story about a young child who had gone for a trip with her parents to Mexico. And when she came back, she had like picked up some bug and had a lot of like abdominal pain. And her father was a client of mine coming in for acupuncture, and he was just discussing with me that his daughter was experiencing this pain in her abdomen, and they had been on different courses of antibiotics and she wasn't feeling much better. So I told him about this acupressure point and how he had to use his daughter's wrist to measure on her hand the point location. And I asked him to kind of massage. And I also said, you can also go along that channel and look for different spots on the forearm, like in the middle of the forearm, on the palmar side, and look for points wherever it felt really sore and just press on that area. And he came back like the next week and he said his daughter had like big, like, sorry for being so graphic, but she had big bowel movements after that. And after that, her stomach completely cleared and she didn't have abdominal pain. So it can be very, very effective on small children. And if you have any parents who are seniors as well, and if they have difficulty breathing, you can press on this area for them as well to kind of help them breathe better. Okay, anything so far in terms of questions? All good? Okay, so you all have computer desk jobs, and often you might find that from staring at a screen that your eyes become really red and blurry and like, it's hard to focus. So this is an acupressure point right in the middle of, like, if you were looking straight and your eyeballs were pointing straight. So it's kind of the middle of the eyebrow and about 1 inch. So we like to measure inches and everything in terms of body, your own body. So basically it's 1 thumb width above the middle of the eyebrow on both sides. So above both eyes. And these points you can kind of stimulate like so. So you can use upward movement as well. Like if you tend to get really like dry eyes, or like you feel like you're not able to focus properly, or your eyes feel, I guess dry is the most common that I see, or you're getting pain behind your eyes. Like, a lot of people get a headache and they feel it behind their eye. So this is a really good point to kind of stimulate. And in fact, just in the middle of the eyebrow as well, there is a foramen or like a nerve root that you can feel. And I have clients who have severely dry eyes. So you could kind of just massage in there as well. And again, as you notice, I like to do back and forth more so. And you might find that if you do that regularly, your eyes don't feel as dry. And also if you tend to have a headache and I will sometimes then use all fingers and just kind of massage upwards from here, and that should help. So I apply the amount of pressure I'm applying is almost like you make a little bit of an indentation on your tissue. Like, I don't know whether you can see, it's a little bit of an indentation. So I apply enough pressure to do that, but then I go upwards to really kind of relax the muscles like so. And that should help with any like headache in the forehead, or also eye tension, or also dry eyes. Okay. Actually, the previous, like I had shown about this point, which can help you with focus, etc. as well. But on either side, like on the inner side of the eyebrows, this is a muscle that, you know, when we use when we are frowning or focusing as well. So you can kind of go diagonally outward as well to kind of relax the forehead. So you're not like frowning so much when you're focused, etc. to kind of help reduce tension in that area as well. Okay.
We have a nice comment from Michelle Hamlin saying that the one that worked immediately for her dry eyes. So thank you.
Oh, awesome. Thank you. All right, so sometimes we all get a stiff neck from working on the computer, and I will show you a series of stretches afterwards. But right now I'm just going to show you an acupressure point that can work really well. So this is on the side where the nails are, the dorsal side. So between finger 2, so the way I count the fingers is thumb is finger 1, 2, 3, 4, 5. And so between finger 2 and finger 3, right at the base here. So I'm going to draw an X. I'll show you. So right here. Okay. So the way to find it is also like if you make a knuckle. And so, you know, this little indentation here, like right here, that's a good point if you tend to have a stiff neck. So what you can even do here is really use the tip of your fingernail as well to really stimulate in there. And then you can try and do neck movements when you're while you're stimulating, like try and do neck movements like so to see if your stiffness reduces. Okay. The other thing is just make sure that you're not up there with your like shoulders, like drop them and stimulate at the same time to make sure that, you know, you are making sure the muscles are nice and long and not contracted when you're working on your neck. So really good and effective, a little tool when, you know, it's hard to get to a therapist for cure, but it can kind of really reduce pain, etc. But I will show you a series of stretches to help that area as well.
Anu, when you're saying putting pressure on and where you feel the tension, so if we're putting pressure on one of the spots that you're speaking of, and
Yeah.
there's like I guess a tenderness or whatever, is that a good thing or?
It shows that it's going to be effective. Yeah. So when you're applying pressure, like, yeah, this is a really sensitive spot if you tend to have neck issues, etc. So the way acupuncturists like to work is usually, if you've been for acupuncture, most acupuncturists like to needle from the elbows down or from the knees down when they're doing distal points, like points far away from the area of problem. The reason is because there's more nerve endings there and you can stimulate a faster response. And that's why I'm trying to show you some points on the hands, etc., because you might feel that, oh, it's super tender. And that's why when you put a needle there, you can stimulate a faster response by by putting a needle and stimulating your nerve endings in that area. Okay. So yeah, they tend to be really sensitive. So it just, hopefully if you have neck tenderness and you're stimulating this point and moving your neck, you should feel some relief. All right, so now we're going to talk about headache more in the sides of your head, so the temples And then a lot of people get TMJ, so like pain in their jaw. Like jaw tension has become like a big problem, especially for people who have to wear a mask all the time these days for their work. Like I definitely notice because I'm in healthcare, and if I have to wear a mask all day, sometimes the mask rides up, and then you're doing funny things with your neck and your face and jaw when you're trying to see a patient and trying to get proper visibility because you're not supposed to touch your mask. And I find that jaw tension has really increased, So one of the ways is, so the last one was the point that we did for stiff neck was between fingers 2 and finger 3. And this is more between fingers 4 and 5. And again, putting an X in here. And then again, going with your fingertip itself and pressing in there. And the way I do it is while like you can also work here, but you know, if you have a headache, I don't have one, so it's hard to say that whether it's going to be effective right away or not. But when you have jaw tension, etc., I suggest like moving your neck jaw to jaw, opening and closing while you stimulate this point to kind of reduce tension in this area. All right. Any questions so far about acupressure? All good? Okay, so I did mention that one thing I like people to focus on is their breathing techniques while they're doing the acupressure as well. So what I like people to do is really focus on diaphragmatic breath work. By diaphragmatic breath work, what I really mean is you want to push your belly out when you are taking an inhale. I'm going to try and see if I can get to my torso here. So the best way to do it is you keep your hand on your abdomen, and when you take an inhale, you push your belly out, and then you hold 2, 3, 4, and then you exhale and you contract. Okay, so again, when you inhale, push your belly out, hold 2, 3, 4, and then exhale and squish. So notice there was no movement up here at all, because a lot of times when I tell people to breathe, they go. So the inhale has nothing to do with you elevating your shoulders or like doing something. None of that. It's all very quiet. It's inhale, pushing your belly out, really filling the lower lobes of the lungs, holding it for a count of 4, and then exhaling. So there is no movement up here, no like panicky sounds or anything like that. So that's how you are supposed to focus. So, and sometimes you need to practice that, because I remember the first time I heard this, I was shocked, because all along when people used to say to me, take a deep breath, I used to go, and it had not, this is not relaxing. When you breathe like that, it's not going to help you relax. However, if you focus by pushing your belly out and holding your breath and really filling the lower lobes of your lungs with oxygen as well, and then exhaling, you will find that, if there was any anxiety in your chest, you feel calmer. And the reason I'm mentioning this diaphragmatic breath work is that when you're feeling stressed, etc., and you're stimulating these points, just try and focus on your breathing technique as well, because that in combination with the acupressure should really help calm the situation. Okay. And so that's another thing that I like to focus on with the stretching technique as well, because often clients will ask me when I tell them to do these stretches, they will say, for how long? And I really say, feel the end of range of movement and then come back with an inhale and go deep again with an exhale. Okay, so it's all about breath, bringing oxygen in, helping you relax, helping the muscles relax, helping your body relax, and hopefully promote healing, because oxygen is the key. Okay. There's a reason there are all these yogic techniques and pranayam and meditation and all that, because they always tell you learn to breathe right. Okay. So here we go. Stretches to alleviate your neck pain. So one of the main stretches is like pulling your like head sideways. So before you even pull it, just move your neck sideways. So what we're trying to do is bring this ear to the shoulder like so. Okay. So when you do that, then you can add to it by further pulling it down. So I'm kind of pulling it right above my ear. So this is my ear. I'm kind of holding it gently and just kind of pressing a little bit to stretch this side of my neck. Okay. So again, you come back with an inhale, and with an exhale, go deep. And then you can come back slightly with an inhale and go deep again. Okay. So these are good stretches for a desk job. This is really good. What I would also suggest is the side that you're trying to stretch, you could sit on that hand. So you could have your hand like so under you. So it's under your legs. And then, so you've kind of created a little bit of traction here. And then you put your head this way, and then you pull, and you should feel a really nice long stretch on the side of your neck. So another variant of this is, so one is pulling your ear to your shoulder. The other is, so while you're doing this, you kind of move your neck, and now I'm going to try and have my nose pointing into my armpit like so. And so basically I'm just looking down like so, and then putting my hand on top of my head and pulling it down further again. And this will get more to the posterior or the back side of your neck and help stretch that out as well. Every stretch we do here, you should do on the opposite side too. So basically, I'm sitting on this hand, and then I'm kind of looking, like first I'm going sideways, putting my ear to my shoulder like so, and then adding to it. And then coming back with an inhale, exhale, go deeper, or like so, and looking into my armpit, and then going further. Okay, so again, with an inhale, you can come back, with an exhale, go deeper. Okay, good. Any questions about those stretches? Okay, so the next stretch we're going to do here is for the back of the neck. So I am just kind of sitting sideways here, and basically you're going to just look down. Okay, when you look down, you use both your hands at the back and pull down further. This you should really feel in the back of your neck and the upper border of your trapezius muscle as well, which is kind of going on the, it goes to your shoulder blades, your scapula, and kind of goes down like a V. So the more you look down, and if you come back with an inhale and exhale, go deeper, you will find that you might have initially felt tight at the top, but as we keep repeating it, you might find that the tension in the up in the top aspect of your muscle is released, but then maybe you feel a little bit more along the shoulder blades, but keep doing it. And with breath, you will find that it releases quite significantly. Okay. Another one, this is just a good stretch for the upper back, is like, you know, if you have a pillar or a post or something like that. So I don't have, like, I have like a table. So pretend you just grab your like I'm using my table leg, say, and then I just kind of push back with my legs and look down and just stretch. Okay, and that should really get to your back muscles. So it's like opposing forces. So the post is stationary and you're pulling and looking down at the same time, and it should really help the muscles on the back of your upper back, etc., to feel more relaxed. It generally is a very, very good stretch. Okay, so I can discuss more if you have any specific questions, but that's all that I had planned right now. There's a lot more that we can talk about, but I wanted to see what kind of questions, etc., you guys had.
Does anyone have any questions for Anu?